Anticoagulants or blood thinners are medications that are used to help prevent blood clots. There's two different kinds of blood thinners, Coumadin or warfarin, which has been used for many, many years, and the newer ones. We can help you choose an appropriate blood thinner, and please give us a call if you have any questions. With warfarin or Coumadin, patients do have to have their INR checked, and it's a very simple blood stick in the tip of the finger, very similar to checking a blood sugar, but it has to be checked at least once a month, sometimes a little more often, usually done by coming into an office, and some patients do check at home.
Hello, in this video I'd like to tell you about different treatment options when it comes to anticoagulation. So if you have atrial fibrillation, chances are that you've been recommended to go on a blood thinner or an anticoagulant. We use the terms interchangeably. Essentially, these are drugs that reduce the ability of the blood to clot. This can be helpful if we want to prevent any internal clotting, but it can also cause problems if we want the blood to clot. For example, if you start bleeding internally or externally or on your skin. In those situations, we may have to be concerned about the risks of this blood thinner. These blood thinners reduce your chances of clotting. That's helpful if we have any internal clotting going on. But if you're bleeding internally or through your skin, then it can also be affecting you in a bad way. So it's a give and take with these medicines. They can help, but they can also hurt, and therefore we use them with caution. In terms of blood thinners that are used for atrial fibrillation, there are two different kinds. There's the Coumadin, and also called warfarin. It's been used forever. I think even before I finished medical school, it was being used. It's an age-old blood thinner. It is very effective in reducing your risk of a stroke, but it has some issues with it. When you take Coumadin, you cannot have any. When you take Coumadin or warfarin, there's concerns about neutralizing the effect of this drug by taking any food products that have vitamin K in that. So typically that's green leafy vegetables. You can take them, but it has to be a consistent amount every day so we can regulate the dose based on what you take. Many patients opt not to take them, and that can be a problem if you like to eat green salads. You have to regulate your diet. Also, it requires checking blood tests every now and then because your requirement of the dose, because we have to keep changing the dose based on your blood test. The blood test is called INR. It's a little drop of blood that's taken from your finger. It is usually done in our office, but sometimes a patient can get a machine to do it at home. We then adjust the dose of the Coumadin based on your INR level. So Coumadin is effective. The major advantage is it's very cheap. You can get Coumadin, I think, for under $5 a month. So that makes it attractive. What makes it less attractive is the fact that you have to be cautious about your diet and you need regular blood tests. Because of the problems associated with Coumadin, they designed other drugs, and those are called the NOACs. So NOAC stands for newer oral anticoagulant. And there are 4 different NOACs available in the market. There's the Perdaxa, another name is dabigatran. There is Eliquis, another name is apixaban. There's Xarelto, and there is Simvasa. And each medication has its different dosing. There are slight differences between these medicines. So we choose one or the other based on the individual differences between different patients. Perdaxa and Eliquis require twice a day's dosing. Xarelto requires once a day dosing. We also have to know your kidney function because the dosing can change if you have abnormal kidney function. People over the age of 80 may require a lower dose. So all those factors have to be put into a mix before we decide on which one of these drugs, of the newer anticoagulants, are appropriate for you. Now, the downside of these medications is the cost. I've heard people give me horror stories about these drugs costing as high as $500 to $600 a month. Many of the patients, however, can get it through their insurance with a drug plan, and most of my patients get it for under $100. It may be a tier 3 medication where your out-of-pocket cost is somewhat higher, but it may not be outrageous either. So before going on this medication, it's a good idea to check with your insurance and see if you have some way of subsidizing the cost of this medication. These medicines initially can be a little cheaper. We can give you a card sometimes that the vendors provide us with. That card for a month or two can cut down your cost, but it's not a long-term strategy. We can give you some samples, but that again, can be given for a couple of weeks, and it's not a long-term strategy. These medications require that you take it for a long time. Now, I'd like to explain to you the potential side effects of these medicines. Each medicine has its own individual side effect profile, but what's common amongst all of them is the risk of bleeding. So bleeding can be very obvious, like you cut your skin and it just doesn't stop bleeding, or you're vomiting blood, or there's blood in the stool. Sometimes blood in the stool will manifest as black, tarry stools. So don't ignore that. There could be blood in the urine. So bleeding is an issue that you need to watch for. Sometimes the bleeding is in very small amounts in your intestines. So it's not obvious, but it leads to development of an anemia. And so bleeding can also manifest as a low hemoglobin on your blood test. When you go on these medicines, you have to be careful and every now and then get a blood test to make sure you're not becoming anemic. Sometimes it's useful to do a stool test where you want to make sure you don't have blood in your stool. Now, there is an alternative to taking blood thinners. There are patients where it's not a good idea to keep them on blood thinners. These may be patients who have had bleeding in the past on a blood thinner. There may be patients who are falling and are concerned that if they fall and bleed internally, it could be very dangerous. There are situations where they have had bleeding in their brain, where a recurrent bleed can be life-threatening. There are people who participate in activities where they're more likely to get injured. I had a patient who liked to go on a bicycling trips and wanted to make sure that she had a watchman and not be on blood thinners because of risk of falling and hurting herself. In these situations, there's a little device called a watchman that can be placed in your heart. It acts as a filter, and it doesn't stop blood clots from forming, but it prevents them from escaping the heart. And if you have a watchman device put in, it is as good as taking a blood thinner. So a watchman device is a one-time procedure after which there's no need to take blood thinners on a long-term basis.